on a Wednesday. This is Megan. Megan
Hello.
Mobley is a nurse practitioner, family nurse practitioner here at the Auburn Medical Group who will be joining us and speaking specifically about the effects of, well, do we have our tape measure there? We need to be 6 feet apart. So we're demonstrating, we got the measure here and we go.
Well, not quite.
Shh.
But
We were going to pretend to the camera, that whole forced perspective thing.
Yes.
We could get away with it. So we are at opposite ends of the table, and we are teaching everybody to be 6 feet apart when you're with others. Mm-hmm. And that's this concept of social distancing. And if we follow it, then we will be able to decrease the chance of overwhelming our healthcare system with cases of COVID-19, the virus or the disease caused by the virus of coronavirus. It's novel coronavirus, SARS-2, whatever you want to call it. And so, Megan, we right now at Auburn Medical Group are experiencing effects from this whole thing. What are we experiencing this afternoon?
well, this afternoon, it's pretty much radio silence.
Yeah.
There's some patients calling in to get their medicine refills because there's lots of things on social media about how you really should, have 3 months supply of your medication. There's things like that that are circling, recommendations from some source, unclear. So we're getting some calls for medication refills, but really very few patients in the office for most of this week, I would say. Well, you had a fairly busy morning, but...
Yeah, I had a number of patients this morning. In fact, one of the things that we're doing that's new is telemedicine. We've never done it in our office before, even though we've been intending to, and we've been, dabbling with it a little bit. Part of it is because it wasn't paid for, and because of our government making it so that Medicare has to pay for telemedicine. We went ahead and made the jump. And thankfully, there's actually some platforms that let you try them on a trial basis for free. So we've been using these programs. We have the security. We're supposed to do the 256-bit military-grade encryption for patients' privacy. But apparently that doesn't even matter because we've been told that HHS, the Department of Health and Human Services at the federal level, has said, forget it. Just go ahead and use FaceTime or FaceTime or even Messenger on Facebook or Skype, which we haven't been using those. We've been using the one with the proper encryption. It's actually been a really good experience for me. Megan hasn't tried it yet, but we've had another physician assistant in our office use it, and it's great for many things. We're able to do it over the phone. Patients don't need to expose themselves to the risk of coming into the office and being around all of our germs and those of our patients. Although we do keep that risk down in our office almost completely eliminated because we actually have a completely separate entrance to the office for people with respiratory symptoms. They don't even go in the waiting room at all. They actually leave through a different door to outside and are seen in a different hall of the office from patients who are a little frail or if they have diabetes or kidney disease or some other immunocompromised state. They won't even be exposed to people that we're working up for coronavirus. Maybe a little update on testing. Megan, have you done any testing yet?
I have not. I haven't seen any patients that I felt it was warranted for. I know you've done a few tests.
And you make a good point there. It's not for everybody who has respiratory symptoms. Oh, I want to get tested, which we had calls. In fact, we had calls from people with no symptoms who want to be tested. I'm a little confused. We test you today. It takes 3-4 days to get the results. So when we know that you're negative from the test we did because you didn't have symptoms, I guess we have to test you again because you might have it now. So it makes no sense to just go around testing people to see if they have it, even though you can have it without symptoms. And because of the limited supply of the test, we're kind of limiting it. So we're limiting it to people who really have a lot of social contact, like the checkout person at the grocery store, or people who work in healthcare who are still going to work.
Mm-hmm. Exactly.
Yeah. Have you done any tests at all?
No.
Not even done any tests?
No.
Okay. So that will be coming up very shortly because we're going to see it. We're going to see it soon.
Absolutely. And we are prepared.
Yes. So do you know other people who are affected, family members or friends outside of the medical world?
Sure. I have a number. I have a elderly grandmother who's canceling tests, kind of hunkering down at home. Family members whose businesses are slowing down because of all of the outbreaks. So it's definitely, we feel it in healthcare, but it's felt in other sectors. I'm sure a lot of you watching are affected and can speak to that as well. So yes.
Okay. One of the things we'd like to do is open this up to our viewers, especially channel members. And if you're not a channel member, would like to be, all you have to do is hit the little join button that's underneath our screen where you see it on YouTube. It might be a little hard to find on some people's mobile devices or computer browsers, but there will be a join button somewhere, either on the video or on our channel page, Auburn Medical Group, where you can be recognized by us in the chat. And I'm going to go to the chat right now. Whoa, lots of people. Lots of chat going on here. So we'll look and see that we have Bianca and Laura Spurs, some of our regulars. They're already on. And Bianca says, I told my mom and dad to stay home, and we will get everything for her. Absolutely. Very good. We want you to do that. If you're able to help out people who are elderly or your parents, please get stuff for them, wipe it down with Sandy wipes or some kind of disinfecting wipe and give it to them. If you do visit with them, please be good about hand washing. I know we love to hug and touch, and it's very important. Human touch is very important. We recognize that here. In fact, you have a story about that we'll get to today. But please refrain for now, please, just till we get through this. And wash hands, don't touch eyes, nose, and face. And here's a little thing. If you at home see Megan or myself on this show touching our eyes, nose, or mouth, please call us out on it. We want to know, because we would do it to you. Okay, back to some more comments here. Bianca notes, a high school lead in college. She's talking about her 16-year-old. And is it because she's not in school? Is that why, Bianca? Let's take a look. I have to back up a little bit. Oh, okay. So moving on, we have another one who says, Terry Humphrey says schools are closed for the next 3 weeks, testing the kids. Oh, wow. So they have enough tests to do that. And one of the interesting things with our chat, we don't know where you're writing from unless you tell us here. So people will be in the UK quite often. Actually, I don't know why we're so popular in the UK. It's a different health system, but maybe you're really interested in ours. Let us know where you're coming from so we can get that message out, how things are different in different parts of the country. In our school system here in Northern California, school's closed. For many of the colleges, school has been closed for the rest of the school year. Not necessarily closed that they're not doing classes, they're doing them online. And the elementary school kids are even doing online classes right now. So it's still happening, but that is still quite a disruption, because even though that they've had classes still going on, they may still need some kind of supervision, or parents who normally work and the kids are at school want to be at home. That's very disruptive for a lot of people. And in fact, it's going to really test our resolve at doing this next 8 weeks of having people out of contact with public gatherings. Go back to the comments here. Bianca notes that her parents are 72 and 83. Oh my goodness, with diabetes and leukemia. So it's COPD. So yeah, those are the people that we really, really need to protect. The way I put it with one patient today is, I'm fine. If my children get sick, if I get sick, we're going to get over it, most likely. I mean, overwhelmingly, most likely, we're going to get over it and be fine. But for Bianca's parents, it's not much better than Russian roulette. It's better, but not much better. And if that's something that kind of scares you, the idea of spinning the chamber on the revolver and going ahead and pulling the trigger, then take some cautions here. And I think most people are. I don't think anybody... And I'm walking this tightrope between panic or things that might incite panic. I'm not panicking. Things that might incite panic in people and make them too anxious, which is a problem when something like this happens. But yet wanting them to take it seriously enough that they don't do things where they're not being safe enough to protect other people in their community. So do these things to protect people in your community. Don't panic. Don't get anxious. And it's going to take a lot of patience to get through this whole social isolation thing, if it is for 8 weeks, which is what we're looking at here in the United States. 8 weeks of trying to keep transmission down as low as possible by not transmitting it, social isolation, washing hands, and not touching. if we can do that, many of you have already seen this all over YouTube. You're watching YouTube if you're watching this, of this concept of flattening the curve so that we don't have this spike in cases that overwhelms the healthcare system. And these people will need ventilators, a lot of them, because before people die of COVID-19, they're having respiratory problems, a respiratory failure. So ventilators are used and can get some people through it, a lot of people through it that otherwise would have died from it. Without the ventilators, these people will die. And so a huge difference can be made in how many people die from it by having the services available, by us being really good through these next 8 weeks and slowing the spread, and also giving us more time to get the vaccine, although that's not going to happen in 8 weeks. Which, news item, it started human trials. So that's good news.
Yeah, I saw a photo of them injecting the first person with the
You did?
with the vaccine. Yeah, it was a woman.
I understand it's being done in Washington State, which is, you couldn't pick a better place in the United States. You could pick a better place outside, like maybe Italy, but
yeah.
Except to do it, you need some people who haven't caught it yet, so maybe not Italy.
Yeah, that's tricky.
Yeah. So I was talking before about human touch, so important.
Yes, I know, and I had to break the social distancing rule today. I had a patient who was very panicked this morning, very nervous. Should I even go to the grocery store? Should I even go and pick up the prescription that you've sent in for me? And I had to tell her, coronavirus is certainly not something to take lightly. However, there are risks with continued panic, elevating your cortisol levels, increasing your risk for chronic disease on that side. And so she was so stressed out that I had to break down and say, we're breaking the rules. And I had to give her a hug because she just needed that. Sometimes we all need that, don't we?
Yeah. No, I didn't fire her for it. So.
Thank goodness.
Next time.
Okay.
Yeah. Another thing that's brought up is the panic buying that's going on in the stores. That's an effect of COVID-19 on all of us, especially when you can't buy things. Like somebody was commenting, one of our gentlemen was at Bianca or Laura was saying she can't find paracetamol, or for us in the United States, Tylenol. Something as simple as that you need. Other people are seeing food items or toilet paper or Thousand Island dressing.
Yes.
was one of them.
Tofu.
Tofu?
I could not find tofu anywhere.
You need tofu.
Yes.
Okay. We'll go catch a tofurkey for you.
Yeah. All right. I'll look forward to that.
And this is because of a completely unfounded panic. There is no limitation. And I tried to explain this to a patient who wanted a whole 6 months worth of all their prescriptions all at once here. And I wrote back, there is no limitation to the supply of medicines. There is no predicted problem with supply chain of medicines. And we will go ahead and keep giving medicines, because if we act on these requests to get ridiculous amounts of supplies of something for somebody, what will result is there's not enough for people who need it. Like another patient I spoke with through a telemedicine encounter who said, we only have 1 box of baby wipes for our infant because people have taken them all from the stores. That's not cool at all. And there's no reason for it. You don't have to have more than what you need. So my message would be to encourage people, don't panic buy. If you see someone with a shopping cart next to you full of milk, don't think that you have to get milk or you're never going to have any. The supplies will come the next day, and hopefully all these people that have too much milk will, share, because they're not going to use it all before it goes out of date. Have you seen anything else?
At the grocery store, or just generally?
General observations of human behavior. Or
gosh, I did see one interesting thing on, I forget, some social media site, I'm not sure, that thought this was just a ploy by the government to keep us all indoors.
Okay.
So that was an interesting.
I did find something I didn't expect in some of my research for today's show, and that was that there was an article published, or maybe it was a study in Nature just recently, maybe it was just today, in fact, that addressed this question of, could this have been a manufactured virus? And I guess that there's certain characteristics genetically that would kind of give it away if this had been manufactured. And they said that by what they would look for a manufactured virus, it did not fit that. It was not consistent at all with somebody purposely creating this virus to infect people. It very much looked like it was from natural sources, and specifically looks like it came from an animal source. I know that a lot of that has been going around, bat soup or the animals in the market in Wuhan, China, but it's not known for sure yet that it came from an animal source or what animal. It just looks a lot like it with the best research that's been done up to this point. So I'll go ahead and look back at our people who are commenting on our YouTube channel here with the live stream.
No, it looks like a lot.
It's a lot of it here. Let's see here. We have other things here. We have a conversation going on, so I'm trying to skip over the conversation to things that would be more relevant to our audience watching either during the show or after the show. And, oh yeah, people trying to get pet food. And Laura Spur is telling us the stores in San Diego are not getting deliveries. I went this morning when they were having at-risk and seniors go in before the store opened, and nothing. That sounds awful. That's the first I've heard of any situation like that at all. And more talking, they have a conversation amongst themselves in our chat, so you're welcome to join that. Not really relevant necessarily to what we're doing right here. And Leanne has a comment. She'll share it from off screen here.
The voice from off screen. We had a patient call in that said that they heard that if you are O positive blood type, that you are more likely to get.
Yeah, please stop looking at Facebook or even YouTube for that matter, which is where we are, for medical information. Please go to the CDC website, cdc.org, or coronavirus.gov, not org, .gov. cdc.gov or coronavirus.gov for coronavirus information. Mm-hmm. Don't pass along these ridiculous things that you see on social media. Please stop it. And the O positive thing, please, no, we don't need things like that. There's a lot of stuff that I won't even comment on because people will just suggest anything. And you really can't say absolutely for sure no until you go and you get online and you look into some publications and you look at the CDC website until you find that no, there's absolutely nothing about that ridiculous thing. So if we would just stop spreading every little thing that comes across our eyes, maybe we wouldn't have to be doing so much research to find out what isn't real. And I'll be looking at the CDC website. I'll be looking at Nature or which other publications or the Johns Hopkins University website. And I encourage you to do the same. We put a link to the map of the Johns Hopkins website, which shows you the most up-to-date information on the world situation so that the less reputable things, do not pass them on, please. And I think that brings us back to the end, or to the end of our update. Thank you so much for joining us on a slightly unusual time, 2:45 on a Wednesday afternoon, but it's because we actually had absolutely zero patients in this 4-provider office this afternoon. Partly our own doing, telling people you don't need to come in for that right now. It'd be good for you to stay home. It's not an emergency for you to get that taken care of. Taking care of people with telemedicine, which actually is okay because then we still actually are doing our job. Mm-hmm. But you can't do that for everything. You can't listen to lungs over it. Well, you can, but we don't have that set up and we don't have any patients with the equipment for it. So we'll be here.
One day.
Yeah, we'll be here for those patients who show up. Looks like tomorrow's going to be an incredibly light day. So if you're in good health and needed something to get taken care of, maybe it'd be okay to come in and see us tomorrow.
We'd love it.
Either
Please come see
Megan,
us.
Arena, or myself. And of course, we send our greetings to Dr. Gwaine, who's on vacation with his family, and I know you all are glad for him to be able to spend some time out away from work enjoying, rainy Oregon? Is that what they're... I think that's where he is. I know their plans changed because of COVID-19, because of people moving around or staying in because of that. Their vacation plans had to change, but they're still able to be without having contact with large groups or going into restaurants and things like that, which is how vacations change. Mm-hmm. I think vacations to a beach with people at least 6 feet apart would be an okay thing. I'm kind of thinking that might be, especially if people can't work.
Sure.
Yeah. And again, our hearts go out to those people who aren't able to work. It's estimated that 18% of our country, United States, is right now having reduced hours or just plain out of work or even got laid off or fired because of COVID-19. The headline is fired and then in small print or reduced hours. So the truth is 18% reduced hours, mm-hmm. including some people that, being fired as reduced hours. And hopefully this, I guess it's now a $1 trillion stimulus package that's being proposed by Congress. I think that's the latest that I just read before coming in here. Of course, not quite sure where that money's coming from, but it may be necessary for small businesses and people who aren't able to work to get by, or to be able to still get paid by their employer who can't give them work. And we'll see what happens with that. That's actually more interesting to me right now than the disease itself, although I understand the need for trying to flatten the curve and why we're taking these measures we are. But it's going to be a huge economic cost. Mm-hmm. We're yet to see how we get out of that. But we will, and the people we love more of them will be alive and survive because of that. So thank you again for joining us. Megan.
Yeah, thanks for having me.
Our people got to see you again.
I know.
It's been such a long time.
I know. I think I was a student here last time I was on.
Oh my goodness. It wasn't right after you got, okay. Well, thanks that's right. That was before you got licensed by the state.
I know.
Yeah. So, now Megan's a full-fledged FNP, family nurse practitioner, here practicing and seeing new patients at the Auburn Medical Group.
Yeah.
Thanks again. Until next time, Dr. Mark Vaughn telling you, and Megan too, to stay in good health. Stop and complete.
Sorry.
And Leanne says goodbye.